Remote patient monitoring is a program where we are able to bring healthcare to you. It allows you to be able to test your vital signs just the same way we would test in the hospital, so that way your healthcare providers are able to see the day in and day out of your vitals during the day, how your everyday flow is. The purpose of this is to be able to get data at home, so that way you're in a more relaxed environment, you're in your natural environment, where when you go into the doctor's office you can have anxiety or be nervous, and that can cause your blood pressure to go high. So therefore then it looks like you have high blood pressures when you really may not, where at home you're in your more natural environment and we can get an accurate normal blood pressure potentially. It allows us to be able to see what those blood pressures are doing, then allows us to reach out to the providers that we work with, who then can reach out to your OB provider to let them know of what your data is doing, as if we need to do additional testing, such as lab works or medications, etc.
You get a blood pressure cuff, you get a pulse ox machine that tells us what your pulse ox is. You get a scale, and you can also input your symptoms, and you can tell us how you're doing in your depression screening. And this information is gathered, and we analyze it and give it to your provider to get you the care that you need sooner, so you don't have to go into the doctor's office. You have a nurse that's assigned to you that is an OB trained nurse, and we have advanced providers that are on staff, and they are trained and they can get medications or anything that you may need, and they also can talk to your OB provider.
How to tell if your blood pressure is accurate and meaningful: you have to sit down and rest for 5 or 10 minutes prior to taking your blood pressure. Don't go rushing around and then, oh, yep, I need to take my blood pressure now. Make sure you sit and rest for 5 or 10 minutes and then take your blood pressure appropriately. It's always important to make sure you rest as well when you check your pulse ox, because we do not want your heart rate to go above 120. If it is above 120, we need you to sit and rest for a few minutes and then place that pulse ox back on your finger to make sure that your heart rate is coming back down to a normal level. You want to check in whenever you're having any symptoms, or if you fall into the yellow zone and you have questions for me or our team. We will call you daily if you have problems. If you have elevated pressures or abnormal survey questions, we will give you a phone call. If everything is fine, then we will not bother you unless it is once a month or so. As long as everything's kosher, we may send a message on the tablet and or give you a phone call just to see how things are going with your OB appointments and providers after or around appointment times.
Preeclampsia is a disorder unique to pregnancy, and it's characterized by high blood pressures and protein in your urine. What's happening is your blood vessels are clamping down and not choosing to share with your baby or organs. So this can cause some pretty severe issues if it's not caught early. So the importance of this program is getting those daily numbers help us to detect it as soon as trouble's starting to creep in. If you go too long without detecting it, you can suffer from seizures and stroke and have issues with the baby as well, which is not what we want. The cure for preeclampsia really is delivery. So a lot of our decision making goes into when should you come to the hospital, when is it time for the baby to be on the outside instead of inside, so that you can get your body back to being healthy and normal again. The problem with preeclampsia is that blood pressures can be normal one day and severe range the next, and then back down. So just because you had a normal today doesn't mean they're going to be a problem tomorrow or a week from now. We don't know exactly what causes it or why it sets in when it does. So the more data we get, the better we can really cure for you and differentiate between preeclampsia, or is this chronic hypertension? Is this severe preeclampsia where we really need to have a baby out now? As your OB provider, I really appreciate having those daily data points so that we don't rush to a preterm delivery if it's not necessary, and that we can keep you home and relaxed and stress-free to get as much out of the pregnancy as possible without risking you or your baby's health. Another hard part about preeclampsia is that many of the normal symptoms of pregnancy, like headaches, fatigue, dizziness, swelling, those can quickly turn to severe symptoms of preeclampsia. So the way we really can distinguish what's preeclampsia and what's normal is by talking to your nurse. So you have your own OB nurse at your disposal. Just pick up the phone. Hey, is this headache normal, or is this something I should go get checked out for? You know, it's very difficult to have a whole new body and all these transitions happening, and we don't want you to sit home and think, this swelling is just normal because I'm pregnant. I would much rather you call your nurse and find out if there's something else you can do, or if you do need to go in to get evaluated. So the combination of your symptoms with your blood pressures and your oxygen saturation, your heart rate, all of that put together gives us a really good package to give you the best care possible.
As you're getting closer to delivery, you're in your 3rd trimester, it's very important to test daily, and if your doctor wants you to test twice a day, that is very important, especially if you're on medications. Your blood pressures can change day to day, and we want to be able to catch those things early, get you into the doctor's office or into the hospital if you need to, and with this data, we can help do that for you. A lot of times with your delivery, when you're home, you're very focused on your baby, but you need to keep checking your blood pressure. And we need to know if you're having symptoms such as headache that won't go away, it's getting worse, any visual changes, blurred vision, spots in your vision, sensitivity to light. We also need to know if you're having trouble breathing, any problems with sudden swelling that's not going away when you're resting and elevating. It can be in your hands, in your face. There's also something called epigastric pain. It's pain in your right upper abdomen. We need to know about any of those things. You can mark that in your symptoms, and we can intervene early to keep you home with your baby. Postpartum can also be a very overwhelming time. There's a lot of emotions, a lot of hormones, and we want to be here if you're feeling those. You can give us a call and we can talk you through things. If you need further intervention, we can also help you do that and get you to the right providers. You are in this program for a reason. It's very important to keep following your healthcare journey and make sure your blood pressures are safe. So please make sure you follow up with a primary care physician, and you possibly may need a cardiologist. RPM is here for you. You have an OB nurse at your fingertips. We're checking your vitals daily. Make sure you're taking them daily. Make sure you're responding to your OB nurse. Make sure you're answering tablet messages. And we want to make sure we intervene early, get you where you need to be, and keep you safe during your pregnancy and afterwards so you can be home with your baby.